Alright, so we are going to start with cardiovascular physiology. Now, cardiovascular physiology also includes coronary artery circulation, systemic circulation, and blood flow regulation. Now, cardiovascular physiology. The right ventricle pumps deoxygenated blood through the pulmonary circulation. The left ventricle pumps oxygenated blood through the systemic circulation. Now, as blood passes, there is an exchange of respiratory gases, nutrients, and waste products between the blood and the tissues. Myocardial pump. The pumping action of the heart is essential for oxygen delivery. The ventricles and atria are the four cardiac chambers. The ventricles fill with blood during diastole and empty during systole. The volume of blood ejected from the ventricles during systole is the stroke volume. Hemorrhage and dehydration can cause a decrease in circulation of blood volume and a decrease in stroke volume. In a healthy heart, as the myocardium stretches, the stretch is proportionally related to the strength of the contraction. As the myocardium stretches and the strength of the following contraction increases, this is known as Starling's law of the heart. In a heart that suffers from cardiomyopathy or an MI, Starling's law does not apply because the increased stretch of the myocardium is beyond the physiological limits of the heart. Now, stroke volume is insufficient and blood starts to back up in the pulmonary or the systemic circulation with this. Myocardial blood flow must supply oxygen and nutrients to the myocardium itself to maintain adequate blood flow elsewhere. What do heart valves do? Heart valves ensure that blood flow is one way. Now, coronary artery circulation is part of the systemic circulation that supplies the myocardium with oxygen and nutrients. The left coronary artery has the most abundant blood supply and feeds the left ventricular myocardium. The left ventricular myocardium does the most of the work of the heart. Now, systemic circulation. The arteries deliver oxygen and nutrients to tissues, and the veins remove waste from tissues. Deoxygenated blood is carried back to the right side of the heart, where it returns to the pulmonary circulation. In terms of blood flow regulation, know that cardiac output is the amount ejected from the left ventricle each minute. Normal cardiac output is 4 to 6 liters per minute in a healthy adult at rest. Will cardiac output increase during sleep? No, it will not. Preload, afterload, and contractility all affect stroke volume. Now, preload is the amount of blood in the left ventricle at the end of diastole. Preload is referred to as end diastolic volume. If we are giving someone an increased amount of fluid, can they have a greater cardiac output? Yes, the fluid increase or the replacement of blood increase circulating volume, which eventually increases cardiac output. Now, afterload is the resistance to the left ventricular ejection. In hypertension, the afterload increases. Myocardial contractility affects stroke volume and cardiac output. Poor ventricular contraction decreases the amount of blood ejected. Injury to myocardial tissue causes a decrease in myocardial contractility. With a rapidly increased heart rate, the time of diastolic filling decreases, which decreases cardiac output. Now on to the conduction system. The relaxation and contraction of the atria and ventricles depend on transmission of electrical impulses. The conduction system of the heart generates impulses needed to initiate a normal heartbeat. The autonomic nervous system plays a part by influencing the rate of impulse generation and the speed of transmission. Sympathetic fibers increase the rate of impulse generation and speed of transmission. Parasympathetic fibers originate from the vagus nerve. So what would those do? They would decrease the heart rate. Now, an electrocardiogram, or an EKG, reflects the electrical activity of the conduction system. The normal sequence is normal sinus rhythm, which you may see written as NSR. Normal sinus rhythm implies that the impulse originates at the SA node and follows the normal sequence through the conduction system. The P wave represents the electrical conduction through both atria. Atrial conduction follows the P wave. Now the PR interval indicates the impulse travel time from the SA node to the Purkinje fibers. The normal length is 0.12 to 0.2 seconds. If the length is greater than 0.2 seconds, this indicates a block in the impulse transmission through the AV node. If the length is less than 0.12 seconds, that means the initiation of the impulse did not originate from the SA node. Now, the QRS complex indicates that the electrical impulse traveled through the ventricles. Normal duration of a QRS complex is 0.06 to 0.1 second. An increase in QRS indicates a delay through the ventricles of conduction time. Ventricular contraction usually follows the QRS complex. We also have the QT interval. The QT interval represents the time needed for ventricular depolarization and repolarization. The normal interval is 0.12 to 0.42 seconds. It can vary with changes in the heart, such as electrolyte values or drugs that increase the QT interval. A shortening of the QT interval occurs with hyperkalemia and hypercalcemia. I will pick up with factors affecting oxygenation in the next audio.